Now we look at another type of nephrotic syndrome, and this one is called steroid-resistant type of nephrotic syndrome. You use steroids to treat nephrotic syndrome, mostly to reduce the damage that is being caused to the glomerulus. Now, there are some type of nephrotic syndrome that will respond very well to steroid therapy. There are some type that when you give steroids, the disease condition is just there, it's resistant to it. That's what we call the steroid resistant type. Yeah. So it's actually one of the most severe form of nephrotic syndrome, and is defined by there's failure of the person to become well even after being treated with steroid for about 4 to 6 weeks. Okay, so there's persistent signs and symptoms of the disease condition, and the disease condition is not getting better in as much as you are treating the person with a steroid therapy, that's prednisone and prednisolone, for about 4 to 6 weeks. So the signs and symptoms of the disease condition is progressing, irrespective, high proteinuria, low protein levels in the body, that's hypoalbuminemia, there's edema, there's hyperlipidemia. So it's probably caused by other focal segmental glomerulosclerosis or minimal change disease. Okay, where there's different mutations in the MPHS1, MPHS2, WT1, INF2, the TRPC6, all of that. Okay, so this one, of course, you have to now switch from steroids to another type of drugs. So epidemiology, in the total nephrotic syndrome, you see this in about 15 to 20%. Then that's it, right? Prognosis is poorer than steroid-sensitive forms. That's the ones that you can use steroid to treat, right? They heal better than this one that resists steroids. Okay, there's a likelihood of more damage. So treatment approaches: calcineurin inhibitors, tacrolimus, cyclosporins, you employ those drugs. Other immunosuppressants like mycophenolate mofetil, cyclophosphamide, rituximab may be tried. They can also be given all those angiotensin converting enzyme inhibitors, angiotensin receptor blockers, diuretics to reduce the fluid for edema, then statins for the high levels of lipids that accompany nephrotic syndrome. Anticoagulation, because there's a risk of abnormal blood clots in a patient that has nephrotic syndrome.